Hi, my name is Lori Powers, and today I will be going over indices, registries, and databases. The first one is the indices. They include the master patient index, disease index, and the physician index. And the first one we'll cover is the master patient index. Now, the master patient index can also be called the master population index or the master person index. Now, the MPI is an index that lists all of the patients that have been seen in a facility, excuse me, and it contains patient identifiable data, which includes name, date of birth, address, hospitalizations, attending physician, and the number of the health record. Excuse me. Now, the MPI is used to quickly find patients for any given query. Lost my place. That the HIM office person enters. Now, the MPI is facility specific and can only be accessed. Sorry, this is going very slow. You can look for specific, its uses is to find specific patients, previous visits, or to find a health record number, and it also helps to avoid duplicate health record numbers. And it can be accessed by the facility. It's facility specific, so you would have to do some search criteria, such as you're looking for a specific date of birth, maybe the physician, you're looking for one of his patients or even all of his patients, and you would put that search criteria in there, and you can view it on your monitor or you can print it out in hard copy. Now, the next one is disease index. And the disease index is comprised of those patients who have a specific disease, or it's, in other words, it is made up of all the diseases that have been coded by the facility. Most things are done by the ICD-9 and CPT codes, and that's how they get put into the indexes. Now, the disease index includes procedures, number of health record, the gender, physician name, the service, results of their diagnosis or any testing, encounter dates. And it's used for finding patient records, specific diseases, quality improvement, research studies, and monitoring the quality of care. You can access it by entering certain criteria, depending on what you're looking for is what criteria you would use. Then you would compile or aggregate the data into a report, and you can either view it on the screen or you can print it out and view it on hard copy. The next one, I'm sorry, forgot I had this on here. I put in here the HIM standard. I took it directly from AHIMA, and it states the integrity of a disease index is maintained. Disease indexes are used to provide cross-reference for locating health records of all patient types for the purposes of epidemiological, sorry, my mouth is really dry, and biomedical studies, health service research, and statistical research on occurring rates, ages, sex, complications, and associated conditions, as well as continuous quality improvement and total quality management activities. Now, the next one is procedure index. Now, the procedure index is pretty much the same as the previous ones because they have the same information coded in the facility. The information contained in each record is pretty much the same, like I said. The only difference is that when you're looking for specific information, for this one in particular, be looking for a procedure that was performed, you put some certain criteria in there and it would bring those up. The types in here, the procedure is basically procedures coded by the facility. Like I said, it's used to find patients who had a certain procedure or for quality improvement, research studies, and monitoring the quality of care. And it can be accessed the same way as the other two, by entering your information, the data that you're looking for, compiling or aggregating the data into a report, and then viewing it on the screen or viewing it on a hard copy. The next one is physician index. Now, the physician index is an equivalent to the disease and the procedure indices. It is a list of the physicians. To find the physicians, that's one of the uses, you put in the criteria and you would aggregate the data and view it or print out a report. Now, it's facility specific, and so you could view it on the screen or print it out. This is strictly for whatever facility that you are working for. Now we'll get into registries. Now the registries include admission, discharge, birth, death, cancer, trauma, and there's some others such as birth defects, death. I'm trying to think off the top of my head because I don't have that one in here. Anyway, there's other registries as well. Now the first one is the admissions registry, or it could also be called the census register, and it lists chronologically all admissions by date. It includes the admission date, resident name, medical record number, and where they were admitted from, whether it be from another department or another hospital, or maybe from a doctor's office. It's used to compile statistical information and then into a report for the facility. It's used, let's see, unless it's required by the state law, facilities can determine the format and content of the admission or discharge register to meet their needs. That's directly from AHIMA. Excuse me again. And that's it on that one. Now the next is the discharge registry. Now the discharge registry, again, is the same thing. If it is, unless it's required by that particular state law, facilities can determine the format and content of the admission discharge register to meet their needs. And then that's directly word for word from AHIMA's website. Now the discharge registry is similar to the admission registry, but instead of admission information, it has to do with all the patients that have been discharged from the facility. Now this register can be either manually entered or managed manually, or some facilities may have a computer system or a computer program that will do it. Now this is helpful in compiling statistical information and reports for the facility. Now this includes discharge date, the patient name, medical record number, where discharged or disposition of the patient. Optional information is where they were transferred from, maybe they were returning, so it would be a return date, their length of stay, and who the attending physician was. Now this is facility specific. Again, you would put in search criteria, aggregate the data, and then view it on the screen or print it out in a hard copy. Most times you're only going to be doing this when the facility needs a report done because they're doing something with it. Now the birth registry. Now the birth registry is a registry of all births within a given time frame, and it just depends on the facility when they want to run a report. It could be quarterly, it could be yearly. It just depends. So the time frame could be a long time or it could be a short time. And it's used for research, epidemiology studies, and other public health programs. Now, the other, when I said that there was other registries, I was trying to say birth defects registry. But my mouth, like I said, is very dry. It's very late. I was having computer problems, so it took me forever to get this finished. And the birth registry includes information on the child, information on the parents, and about the mother's pregnancy. And it's, again, facility specific. They use it for quality of care and performance improvement. And this registry can actually be accessed via the National Vital Statistics System. And that could be, they do have a website. I'm sorry, but for some reason, like I said, I was having computer problems and it just would not put it in there. Now, the death registry. Now, this is a list of all the deaths, like a birth certificate, the birth registry, only this has to do with death. So it is a list of all the deaths that's happened within a certain amount of time. And it is kept by the National Vital Statistics. It includes decedent information, place of death, medical certification, and the disposition information. It is facility specific as far as how you want to do it, but it is accessible through the National Vital Statistics System because they do have to report it, like the birth certificates or birth registry. They have to report this to the vital statistics. Now the cancer registry. I'm sorry for the small font, but there's a lot of information here. And again, I've been having problems with my computer. My word wrap isn't working right, so I've had to kind of play with it. Now the cancer registry is a group of facts or a collection of data on the manifestations or occurrences of cancer, the types of cancer, the location inside the body, and the disease stage of the cancer, such as stage 1, stage 2, stage 3, and like my mom, she had stage 4, which is terminal. And that also has the kinds of treatments. Now, when it's put in to the system, it is given an accession number, and I'm not sure if I'm pronouncing that right. It monitored cancer trends, determined cancer patterns, guide planning and evaluation, sets priorities, allocating health resources, research, and the National Database of Cancer Incidents is where you will find this information. Oh, excuse me. Now, the cancer registry includes aggregated data, types of cancer, gender, age, and ethnic group. You can access this, and I took this directly from the CDC's website, hence the reason why that very last link, because like I said, this is where I got it. You can actually access the cancer registry and statistics from this link here at the CDC. It's the National Cancer Institute. They've combined their data sources so that they can publish yearly federal cancer statistics at this website. Now, the trauma registry is basically a database for patients who have had severe traumatic injuries, such as an automobile accident, a gunshot stabbing, a mugging, rape. I would assume that would be it. That wasn't listed, but or falls. And it includes the demographic information, injury information, the patient care, patient status, the patient's course at the hospital, diagnosis and procedure codes, an abbreviated injury scale, and how severe the injury was. Hence, the injury severity score is just how bad was the injury. Now, you can access this information by doing a search in your system for trauma codes, for death codes, neurosurgery, orthopedics, and plastic surgery. I believe, yes, some hospitals also report their trauma data to a national trauma database. So you could actually, if this is what your facility does, you can always access it that way as well. We were supposed to do one in our state, so I picked Washington Nurse Aid Registry. Now, the Washington Nurse Aid Registry is an organization that is in care of preserving a record of skilled people who have met the state and federal requirements to deliver nurses' aides services to long-term care facilities, skilled nursing facilities all over the state of Washington. And what is included in this is the identifying data, the nurse aide her work records or his work records, their eligibility for employment in a long-term care facility, and the big one is if there's any instances of abuse, neglect, or misappropriation or stealing of the client's property. And this all can be accessed online. Usually it's only accessed by the nurse's aides or a nurse aide employers, so that they can confirm their standing as to if they have any problems, if they've abused, neglected, if their licenses are still good. And I put here the web address that it can be accessed at. Just 1 second, I've got to take a drink. All right. The next one is healthcare. These are now, we're going to start the databases. And I didn't list those because there were a lot of them. The first one is the Healthcare Cost and Utilization Project, or HCUP. Now, this organization uses data that's composed at the state level, and it comes from either claims or discharge abstracted data. And what's included in here is nationwide inpatient sample, state inpatient ambulatory surgery database, state emergency department database, abstracts for visits that do not result in hospitalizations, and the kids' inpatient databases. This all can be accessed at this website. And I'm sorry, I'm going kind of fast, or I'm trying to anyway, because it's getting late and I have a baby coming early and I just need to get this done. And it's late getting turned in. Now the next one is Health Effectiveness Data and Information Sets, or HEDIS. H-E-D-I-S. I don't know if you can actually pronounce it into a word. But this is to measure performance on important dimensions of care and service. And what's included is identifying the clinical area to evaluate, conducting an extensive literature review, developing the measures with the appropriate MAP and other panels, vetting it with various stakeholders, and performing a field test that looks at feasibility, reliability, and validity. And it can be accessed through the NCQA. They have an online reporting tool called Quality Compass, and for quite a bit of money, you can go ahead and access that. This wording is strictly from their website, as I wasn't sure how to reword this to make it make sense. So I left it as is. So you could go to that website. I have another database in here that goes, I'll let you know which one it is. It's the same website. Now the next one is the National Ambulatory Medical Care Survey. Now this is one of the main public health surveys in the National Healthcare Survey. It is office-based physician practice. The data is on the patient and on the patient's visit. The state discharge databases, office-based physician records, and then the data is abstracted. You can get this information at this website below. The next one is the National Hospital Ambulatory Medical Care Survey. And the National Hospital Ambulatory Medical Care Survey is designed to collect data on the utilization and provisions of ambulatory care services in hospital emergency and outpatient departments. Now, these findings are based on the national sample of visits to the emergency department and outpatient departments on non-institutional general and short-stay hospitals. Now, that is word for word from their website, which I have put down here. And they look for to meet the needs for objectives, reliable information about the provisions and use of them toward medical care services in the United States. And the data that they obtain, which includes symptoms, the patient's symptoms, the physician diagnosis, medications ordered or provided. And it also offers statistics on the demographic characteristics of patients, the services provided, as well as information on diagnostic procedures, patient management, and planned future treatment. And again, you can access it right there. Now we have the National Nursing Home Survey. Now this offers data on current residents and discharged residents. Residents are the patients. My son actually worked in a nursing home or a long-term care facility, and they do not use the word patients. These people are residents. And patients is not something that is appropriately used, because some of these people, they are actually there till the end of their life, and so they are considered a resident, such as I would be a resident in an apartment complex. Now, what's included in their survey is the ownership, size, certification, admissions, services, full-time staff, and what fees they charge. And you can access this information at this website, at the CDC website down below. I'd have more information, but some of this information I couldn't find. Now, the National Home and Hospice Care Survey. Now, this is a database that is gathered on the home health or hospice agency, as well as on their current and discharged patients. Now, they include the referral from the doctor or hospital, the length of services, which is how long did they take care of this patient, what the patient's diagnosis was, how many visits did they do to the home, patient charges, how much is the charges for, what is being done for the patient, what the patient's health status is, why they discharged them, and what types of services they provided. My mom had hospice care, and so this all was in there, and it was actually pretty interesting. These people were amazing. You can access this information down here at this website, at the CDC website. CDC has a lot of information on a lot of these things. So sometimes it's a good idea just to start there. Now, the National Electronic Disease Surveillance Systems. And I believe this is the website I was talking about, that you could also find the other one. Now, this is an internet-based arrangement for public health shadowing data transfer, which means that they just watch any transfers of data, so that they use precise PHIN, or Public Health Information Network, and the NEDSS data standards. Now, this includes a system of interoperable subsystems and components and system modules. It's more technical, but they're wanting to make sure that everything is done correctly and securely. And this is the website you can go to. Alright, this is the Washington State Vital Statistics. Now, these guys, they handle quite a bit. The Washington State Vital Statistics is where they have certificates of birth, death, marriage, fetal death, divorce, and you can go ahead and go there, and I mean, this is pretty self-explanatory. I think we all know what the Washington State Vital Statistics is, but their website is right there. Now, the Clinical Trial Database is a registry and the results of federally and privately maintained clinical trials that are done in the United States and around the world. And this includes the purpose, who is participating in the trial, where the trial is located, and the phone numbers, so you can get more detail on the trial. And this is a government website that has information for that. Now, the National Practitioners Data Bank. is a collection of information that regarding sanctions taken by state licensing authorities against all care practitioners and entities. Now, this is word for word for, I believe it's word for word. I think I might have changed a word here and there, but it's directly from their website. And this includes unprofessional behavior, reporting of medical malpractice payments, restricting the ability of incompetent physicians, dentists, and other healthcare practitioners to move from state to state, any adverse actions that involve licensure, clinical privileges, professional society memberships, and exclusions from Medicare and Medicaid. Now, you can access this at the NPDB, but it's not available to the general public. Sorry. Access to this information is limited to entities specified by law, and at this website they actually have a listing of who can access this information. And this is sensitive information, so hence the reason why you are unable to not everybody can just go in and check it out. Now, Healthcare Integrity and Protection Data Bank is a federal data bank that has been formed to serve as repositories of information about healthcare providers in the United States. And federal law requires that adverse actions taken against a healthcare professional's license be reported to the data banks. Information about nursing discipline actions is reported to the HIPDB. And this, again, is not available to the public. It includes unprofessional behavior, reporting malpractice payments, restrictability to of incompetent physicians, dentists, and other healthcare practitioners. It's basically the same thing as the other one. Medicare Provider and Analysis Review. Now, this is from claims for services provided to beneficiaries admitted to Medicare certified inpatient hospitals and skilled nursing facilities. Again, this was word for word from the website. And this includes demographic data on patients, data on provider, information on Medicare coverage, total charges, charges broken down by service, ICD and CPT codes, and the MSDRGs. And you can access this information right there at the CMS website. Now, in summary, indices, registries, and databases are ultimately all important for quality management, research, and quality of care for each facility. Now, to recap different indices, registries, and databases, there is Master Patient Index, Disease Indexes, Procedure Indexes, the Physician Indexes. And each of these are similar to the others as far as content, use, and access, except the only thing different is that it's how you find the information. They are facility specific, and so there's no set rule to follow other than, of course, your facility procedures. Registries include admission, discharge, birth, death, cancer, and trauma. And there are others besides these that are listed. I don't have them listed here, mind you, but you can find them online. Each one of these registries are similar in some extent to the indexes, although these have rules and standards that must be followed. Since like the cancer registry, it's not facility specific, so it has a set format and entry requirements. Now, the databases are a lot of them. There are numerous databases. Each one is vital in its own way, and the use of database helps to have all data that a facility will need for quality improvement, quality of care, for research. The following are databases. Now, the Healthcare Cost and Utilization Project, Health Effectiveness Data and Information, National Ambulatory Care Survey, National Hospital Ambulatory Medical Survey, National Nursing Home Survey, National Home and Hospice Care Survey, National Electronic Disease Surveillance System, Clinical Trials Database, National Practitioner Data Bank, Clinical Trials Database, National Practitioners Databank, Healthcare Integrity and Protection Databank, and Medicare Provider and Analysis Review. Now, I know I didn't have probably as much information as I should have, but again, I was having so many problems with my computer that everything stopped working. And by the time I got everything done and ready to record, it was after midnight. So, Mr. E, be nice. Thank you.